Welcome to the Immobilization Skills Traction Splinting Station. This station is designed to test your ability to properly immobilize a mid-shaft femur injury with a traction splint. You will have an EMT assistant to help you in the application of the device by applying manual traction when you direct them to do so. The EMT assistant will perform correctly all instructions given by you, however will not perform any procedure unless instructed to do so. You are required to treat only the specific isolated injury to the femur. All assessments have been accomplished on the victim and a mid-shaft femur deformity was detected. Continued assessments of the patient's airway, breathing, and central circulation are not necessary. You may use any equipment supplied for this station. You have 10 minutes to complete this skill station. Do you have any questions?
May I look over my equipment?
Please look over your equipment and advise me when you're ready to begin.
I'm ready to begin.
Okay. You respond to an assisted living center where a resident fell against the toilet in the bathroom. The resident is complaining of pain and swelling in the middle of their right thigh. There are no injuries, just the isolated mid-shaft femur injuries. Do you have any questions?
No, sir.
Okay, you may begin when you're ready.
Scene safe, BSI.
Okay.
I'm going to walk up and take manual stabilization of the injured area. If you would please come forward and check pulse movement and sensation.
Ma'am, I'm going to need to take your shoes off, all right?
Okay.
All right. I'm going to need you to wiggle your toes. Good job. Pulses equal bilaterally. All right. What toe am I touching?
My right big toe. My
What
right
toe?
big toe.
Okay. Motor, sensory, and circulatory function are present and normal.
Okay, would you please now apply the ankle hitch? Now the ankle hitch is applied, would you please take manual traction? With manual traction taken, I'm releasing manual stabilization. I'm going to take the traction splint and measure it out on the patient's uninjured leg, extending it 6 to 8 inches out. Okay, I'm now going to slide the traction splint underneath the patient's leg. All right, I'm going to apply padding for the ischial strap, and I am now going to apply the ischial strap. When applying the ischial strap, I'm going to supply it securely with a slide angle facing towards the patient's head. With the ischial strap secured, I am now going to take traction. Now that traction has been taken, I'm going to secure the leg to the splint by using the first strap here, just above the patient's ankle. The second strap just below the patient's knee. The third strap just above the patient's knee and just below the injury. And with the last strap just below the ischial strap and above the injury. Now that the straps have been supplied, I'm checking to ensure the ischial strap is securely tightened, and I'm also checking traction. Now that is done, I'm going to check for pulse movement and sensation. Ma'am, can you wiggle your toes for me? Okay. And I have strong pulses bilaterally. Ma'am, which toe am I touching?
My left big toe.
Which toe am I touching?
My right big toe.
Okay.
Okay. Motor, sensory, and circulatory function are present and normal. How would you prepare the patient for transportation?
Okay, you can release traction. I would prepare the patient for transport utilizing a long backboard, securing the hip to the backboard as it is the joint above the injury, and securing the traction splint to the backboard as well, preventing any movement or further injury.
Okay. Anything else?
No, sir.
Okay, thank you.